That's slightly different between hip and knee replacements. Let's start with hip replacements first. For a lot of those patients, they've been in severe pain beforehand and often very stiff hips. Many of those patients are surprised as to how little pain they have post-operatively. It's still a major procedure, and they may feel all sorts of temporary symptoms in the immediate post-operative period. They may be off their food, they may feel nauseated, they may feel giddy or dizzy the first time they get up. That's very common. They're minor symptoms that they will, unpleasant experiences that they will have whilst in hospital, but they will all pass. For most people, they will notice with hip replacement that their mobility is much better very soon after the operation, and they'll be able to get up and walk either the same day or the next day after their procedure. However, it still takes several weeks to really get over the operation, and the body has to heal itself. So it's not a bad idea that when you go home, that you have some siestas and breaks to allow for the body to heal itself. For knee replacement surgery, it's a little more grueling. The knee is a more sensitive area of the body. It tends to swell up dramatically after the surgery, and so some patients may experience quite a deal of pain. We'll help the patients whilst they're in hospital with a cocktail of drugs, but it's still not going to be an easy, comfortable ride. Every patient is different, and don't compare yourself with someone else. Some people find it relatively easy, other people are in pain for quite some weeks afterwards. In addition, with a knee replacement, you have to work hard to get the knee to bend and to straighten. So you'll need some physiotherapy, and you'll need to work hard when you get home also to keep working on exercises that you would have been given whilst you're in hospital. So with knee replacement surgery, it is harder, and you'll need to weigh up whether you're willing to undergo what can be a difficult operation, but which has good long-term results. Knee replacement surgery for most patients is a very successful operation. When we do a hip replacement, we often tell patients that they may not even remember they've had a hip replacement that feels so good. That's for the majority. However, when you look at the forgotten joint in knee replacement surgery, it's only about 15%. So some people experience some clicking, some discomfort, and some other little difficulties that they would rather not have. There was an interesting study done in Ontario in Canada where they asked the patients how satisfied they were, and they did find that 17% of patients were not completely satisfied with their knee replacement surgery.
So about 95% of people that have a hip replacement can expect good relief of their pain and improvement in their function about 12 months after the procedure. About 75 to 80% of people who have a knee replacement can expect a satisfactory outcome in terms of relief of their pain and improvement in function, again about 12 months after the procedure. It takes a while for them to recover from the surgery. This is significant surgery, and it also carries with it substantial risk. About 1 to 2% of people are likely to get an infection in their joint after the procedure. They may also develop a clot in the limb that they've been operated on that may also have other effects in terms of being dislodged and going elsewhere. About 1 in 200 people die perioperatively as a consequence of their joint replacement, and this is more likely to occur in older people with other comorbidities, particularly heart and lung related disease. So for a knee replacement, about 1 in 3 people may not necessarily redeem an improvement in their pain, and it may actually either stay the same or get worse. That commonly occurs in the context of an inappropriate diagnosis being made in the first instance, and the pain related to what you thought was knee osteoarthritis may be a referred pain from somewhere else, and or you have substantial comorbidity, particularly depression, that interferes with your ability to respond appropriately to a joint replacement. So in the context where you're unsure whether the pain in your knee is coming from knee osteoarthritis and or you're depressed, really go out and try and find the best treatment option that's suitable for you before you go down a surgical treatment option.